As the global obesity epidemic intensifies, a parallel biological crisis is unfolding deep within the body, at the cellular level, where dysregulated growth signals, chronic inflammation, and metabolic dysfunction conspire to turn excess body fat into fertile ground for cancer. Among the most pivotal molecular pathways implicated in this process is the mechanistic target of rapamycin, or mTOR, a master regulator of cell growth, metabolism, and survival. In obesity, mTOR signaling is chronically overactivated, triggering a cascade of cellular events that not only increase the likelihood of cancer initiation but also accelerate tumor progression and therapy resistance. mTOR is a nutrient-sensing kinase that integrates signals from glucose, amino acids, insulin, and growth factors. Under normal conditions, it coordinates cell proliferation and autophagy, the body's system for recycling damaged organelles and proteins, maintaining a delicate balance between growth and repair. But in an obese state, this balance is lost. High levels of insulin, IGF-1, and circulating nutrients lead to persistent mTOR activation, which promotes unchecked cell division and suppresses autophagy. Over time, this creates an internal environment ripe for genomic instability, mitochondrial dysfunction, and oncogenesis. This dysregulation plays a critical role in several of the most common and lethal obesity-related cancers, including breast, endometrial, prostate, colorectal, and liver cancers. In adipose-rich environments, mTOR drives cells to grow faster and larger, while silencing internal quality control mechanisms that would normally eliminate precancerous cells. Without autophagy to remove cellular debris and mutated DNA, damage accumulates. This is a key point often overlooked. Obesity doesn't just increase cancer risk by feeding tumors, it changes the cellular rules by which tumors emerge and survive. In obesity, the chronic stimulation of the PI3K/ACT/mTOR pathway, a major axis in many cancers, effectively removes the brakes on cell growth. This pathway is frequently mutated in tumors, but in obesity, it is already hyperactive due to upstream hormonal and nutritional signals. Insulin and IGF-1 surge in response to insulin resistance, acting as pro-growth hormones that directly stimulate mTOR. Additionally, adipose tissue secretes pro-inflammatory cytokines like IL-6 and TNF-alpha, further amplifying the signal. These inflammatory inputs not only promote tumor proliferation but also enhance angiogenesis, blood vessel formation, and suppress immune surveillance, enabling tumors to grow undetected. Autophagy suppression is another key consequence of mTOR overactivation in obesity. While autophagy can sometimes help cancer cells survive under stress, its normal function is protective in early stages of cancer development. In premalignant cells, autophagy removes damaged mitochondria and limits oxidative stress, key drivers of DNA mutations. But when mTOR is constantly active, autophagy is inhibited, allowing dysfunctional cells to persist and proliferate. This double hit of increased growth and impaired self-repair accelerates the journey from obesity to malignancy. Furthermore, mTOR activation is linked to resistance against several forms of chemotherapy and targeted therapies. Tumors that evolve in a high-nutrient, pro-mTOR environment often exhibit increased survival mechanisms, altered metabolism, and a reduced response to apoptosis-inducing drugs. This may partly explain why obese patients with cancer tend to have worse treatment outcomes and higher recurrence rates, even when accounting for tumor stage. The liver is a prime example. In obesity-related non-alcoholic fatty liver disease, NAFLD, mTOR is activated early in the disease process and remains hyperactive through steatohepatitis, fibrosis, and eventual tumor formation. Experimental models show that inhibiting mTOR in obese mice can slow or prevent hepatocellular carcinoma, highlighting its role as both a metabolic sensor and tumor enabler. Despite this emerging understanding, clinical medicine has been slow to integrate mTOR biology into obesity and cancer prevention strategies. Most interventions still focus on weight loss or metabolic control, without addressing how these molecular pathways might be directly targeted to reduce cancer risk. Moreover, many cancer screening guidelines do not account for molecular risk factors like chronic mTOR activation, even in high BMI individuals with other metabolic abnormalities. This lack of integration is a missed opportunity. If obesity is priming the mTOR pathway decades before cancer appears, then early intervention, nutritional, pharmacologic, or behavioral, might disrupt the process before malignancy takes hold. Drugs that inhibit mTOR, like rapamycin and its analogs, are already used in cancer and transplant medicine, but their role in cancer prevention for high-risk obese patients remains underexplored. In addition, dietary and lifestyle interventions that modulate mTOR activity, such as intermittent fasting, caloric restriction, or AMPK-activating exercise, deserve closer attention not just for weight control, but for their potential to recalibrate this fundamental pathway. The goal is not merely to shrink waistlines, but to reprogram cellular behavior, to tilt the internal balance back toward repair, immune function, and cancer resistance. The obesity-cancer connection is not just a problem of fat mass, it is a problem of cellular signaling gone awry, with mTOR at the center of the storm. Until we start viewing obesity through this molecular lens, we will continue to underestimate its full danger. If mTOR is the molecular link between overeating and overgrowing cells, then obesity is not simply a risk factor. It is a biochemical engine that drives cancer from the inside out. It is time we recognize and confront it as such, before the damage becomes irreversible.